Education can provide transformative behavior, emotion, and thinking, though medications do not work better when the person understands the pharmacology of the drug. Researching and reading about medical issues can be challenging because the language may be inaccessible and scientific research methodology incomprehensible. However, this is less so for psychiatric issues. People with psychiatric problems, including borderline personality disorder, are encouraged to read books by mental health professionals because they are generally readable, even if you have to dip into a dictionary now and again, as I do. I was recently rereading some early books on borderlines, and I was struck by how instructive these books were, not just for someone who understands the subject, but for anybody with BPD. There is a great advantage to reading about borderlines from professional books rather than just highlights from the internet. For many years, I did not read long history books, but when COVID-19 came around, I had more free time because work was slow and synagogue was closed. So I read big biographies of all the US presidents from George Washington to Ulysses S. Grant. I previously read many articles on these presidents, but reading a long, sustained tome provided an in-depth understanding that would not otherwise have been possible. Similarly, borderline should make the effort to read professional books and slowly absorb the information to gain a better understanding of their issues. For borderlines, knowledge is power, and professional books have case vignettes to illustrate how particular clinical issues affect borderlines in their everyday lives. This allows for the integration of theory with practice with the possibility of real solutions. And that's why for a moment within this video, I want to talk about solution-focused therapy. Searching the internet will yield information about a wide range of therapy options for BPD, and indeed for almost anybody with any problem, including dialectical behavior therapy and mindfulness training. There are numerous other non-pharmacological treatments, including simple rest, music therapy, biofeedback, acupuncture, Tai Chi, yoga, deep breathing, and others, which allows for non-psychological connection between the conscious and the unconscious. However, solution-focused therapy is something that borderlines do not usually come across on the internet searches, although it can be quite helpful, and it focuses on incremental positive steps, future-oriented goals, strengths rather than weaknesses, and coping strategies rather than problems. Solution-focused therapy has several parts. The first part is the miracle question, which asks the person to visualize what it would be like waking up tomorrow if the problem were no longer a problem. Some borderlines can never imagine things getting better, so the miracle question gives the borderline permission to fantasize about a normal life. Generally, fantasy helps us to consider unconscious motivations, often our true passions, that we do not say out loud because it is shameful or simply too hard to articulate. The second question in solution-focused therapy is the coping question, and it asks, what is the most positive or helpful thing that has lessened symptoms? This allows the borderline to identify an inner strength and build on it as a basis for healthy functioning. The third question asks the person to identify when the problem or symptom does not exist. Being able to identify the context when symptoms are absent or less severe can be quite helpful. Lastly, the person is asked to consider the severity of particular symptoms and how a level 8 problem can be lowered to a level 7 problem. Lowering the symptom just one level can be extremely helpful, with the possibility of lowering symptoms even one step further. Another lesser-known modality is nonviolent communication, in which an observation is made, perhaps about the environment, a feeling statement is attached, and then translated as a human need with a request to help attend to the feeling in a manner that allows for increased clarity and empathy while avoiding interpersonal conflict. Counterfactual thinking is a cousin to solution-focused therapy, and it helps develop a capacity for realistic self-criticism and even end vicious cycles of harmful behaviors. Borderlines sometimes suffer from regret, I should not have done that thing, or I should have done that thing differently. And self-criticism, you idiot. Counterfactual thinking is a future-oriented thought experiment imagining a different future. You have to imagine or pretend different scenarios and then work out what could happen next. Imagining a different future and thinking about alternate possibilities and outcomes allows the borderline to defocus from the stress of this moment and consider positive possibilities in the next moment. However, sometimes the single most focused solution to a problem is removing yourself permanently from the problem, which we will look at in the next video.